The daily use of caffeine is becoming more and more popular amongst college athletes, and I have recently been asked what the possible pros and cons of its use are as a supplement for sports performance. To start, I would like to talk about the NCAA regulation of caffeine supplementation. The NCAA currently has 9 classes of drugs on their banned substance list, and this first class is stimulants. Caffeine actually falls under this category. Now, this doesn't mean caffeine cannot be used for athletes. However, an athlete will test positive for caffeine as a stimulant if the urine concentration is greater than 15 micrograms per milliliter. To break that down into simpler terms, this is the equivalent of 500 milligrams or 6 to 8 cups of coffee 2 to 3 hours before competition. Now, the reason caffeine is labeled as a stimulant at this level of concentration is because it can have some significant health risks. For starters, caffeine is an addictive, and this addiction can occur with as little as 100 milligrams per day. With addiction also comes withdrawal symptoms. Some of these symptoms can include severe headaches, fatigue, depression, mood swings, and insomnia. Other side effects with higher doses of caffeine include GI distress, nausea, shaking, irregular heart rhythms, dizziness, and increased blood pressure. Lastly, for athletes who are training in hot environments, when not properly hydrating, high levels of caffeine consumption can cause a decrease in thermal regulation. Now, with that being said, when consumed in appropriate doses, caffeine can be beneficial for sports performance. For endurance athletes, caffeine can lower the perception of pain, fatigue, and perceived exertion to allow the athlete to increase the duration of their training sessions. For task-oriented sports such as golf, caffeine can improve mental focus and energy, as well as neuromuscular control. Finally, for team sports like basketball, caffeine consumption can delay fatigue, increase muscle endurance and maximum contraction, as well as improving motor skills, mood, and relieve anxiety. Now, the recommended daily dose for caffeine is 2 to 300 milligrams per day from food sources. This is comparable to 2 8-ounce cups of coffee a day. When consuming foods that contain caffeine sources such as caffeine chews or bars, it's important to read the labels to avoid added stimulants that may not react well with caffeine. Now, everyone will react differently to caffeine, so it is important to experiment with the recommended daily doses to understand how it affects your body. In addition to this, keep in mind that individuals can build up a tolerance to caffeine with extended use. So athletes should lower their dose or completely abstain from caffeine 7 to 10 days prior to big competitions. Now, for basketball players who compete 2 to 3 times per week, I would recommend increasing caffeine intake to 2 to 6 grams per kilogram of body weight 1 hour before games or intense training sessions. For more information or if you have questions regarding certain ingredients in foods you are already consuming, consult with your team dietitian.